healthcare in a variety of roles for the nonprofit and profit sectors, including as an executive consultant and attorney. Prior to joining John Muir Health, Paul practiced as a healthcare regulatory and transactional attorney at Hooper, Lundy, and Brookman, a nationally recognized law firm specializing in serving healthcare providers and suppliers, including healthcare technology startups. Before practicing law, Paul worked as a management consultant with McKinsey & Company, focused on payer and provider growth strategy. Paul received his bachelor's degree in religion from Princeton University and his law degree from Georgetown University with an emphasis in healthcare economics. Please welcome Paul Dieringer.
Great. Thanks, everybody, and thanks for having me. So I'm getting over a cold, so this is my late night FM DJ voice. Wanted to give a little bit of an update on where John Muir is and where we're going and how we're working in the Tri-Valley area in particular. Before I do that, I am curious, I don't know how you want to show your hands, but I'm curious who is currently a John Muir Health patient or as a family member who is. Okay, good kind of mix. All right, good. So some of this may be familiar and some may be new. So I'm going to share my screen if I have the ability. So let's just find out. Oh, I do. Fantastic. All right, let's go here. Oh, hang on. It doesn't like my. Let me do this. I'm going to share my screen this way instead, so you can actually see my slides. Okay. All right. So there's a little bit about John Muir, and start with just a quick snapshot for those of you who may be less familiar with the health system. We'll talk a little bit about what we're up to. We're about a $2.3 billion company. We serve about 335,000 people a year, principally in Contra Costa, southern and eastern Alameda, and then southern Solano counties, although we do have patients who come from farther away. A little over 6,400 employees. You can see some of the fun stats in terms of newborn deliveries and ED visits. Our Concord and Walnut Creek emergency departments are now tracking toward 130,000 visits for this year, and over 1 million outpatient visits in our multiple ambulatory centers, some of which you may have visited. One of the really important things, though, when we talk about community benefit, John Muir Health is a community-based not-for-profit, and so as such, literally 100% of our economic activity is going back into the communities we serve. And it's really important for us because as a management team, we are our patients. These are our friends and neighbors. This isn't academic. And we think it makes a big difference when your management is local and isn't sitting in Sacramento or Texas. So for us, that aspect of being community-based is a really critical part of how we think about our mission and how we think about when we make service planning decisions, what are we going to do where and how. It's a very personal thing for us and our employees and their families, as well as non-employees who we serve in the community. We've been here for almost 100 years. And if you think about John Muir as such is really the product of a merger of the Concord, what used to be a public district hospital, and Walnut Creek Medical Center. And so Concord has been here since the 30s. Walnut Creek has been here since the 60s. And then in the 90s, they came together to form what is now called John Muir. So as of this year, we continue to be independent, not-for-profit, community-based, and locally operated. And these little arrows down here, for those of you who have driven by our Walnut Creek campus, this is the campus a long time ago. There's a lot less going on in Walnut Creek and the Tri-Valley generally. And today you can see what has built up around it. In that lower right-hand corner, that is the new Bearing Cancer Pavilion, which we'll talk a little bit about, but a really cool addition to how we can care for the community. We have 6 major outpatient sites. So these are collections of both physician offices as well as imaging, lab, and other services. You probably are familiar with the ones in Walnut Creek and Concord. We also have a large center in Pleasanton. And then we're doing something new in San Ramon, consistent with the redevelopment of Bishop Ranch. We're consolidating a number of our current clinical sites into Bishop Ranch 15. So we'll take occupancy there in late April of next year with room to grow. So we're taking about 52,000 square feet in that building, and we have lease-up options above that. And it's part of our broader commitment to more deeply serving what we think of as South County. So San Ramon, we're starting with San Ramon partly because of the real estate issue with Bishop Branch, but also because it's where we have currently our strongest collection of services. And our goal really is to form a really strong southern hub there so we can then extend our services farther south more effectively. So when we think about Livermore, Pleasanton, Dublin, that area, a lot of really great healthcare choices there. We want to be sure that as we extend our services farther south and east, that we're really well positioned to serve those patients. So part of that is making sure we have a really strong base of operations in San Ramon. This is part of that plan. For those of you who've ever traveled Vasco Road, we also have an outpatient center in Brentwood that we've renovated and expanded services in a number of times and continue to do that. And then we have a large outpatient center in Berkeley that we operate in conjunction with UCSF. So it has a combination of urgent care, primary care, and a lot of mixed specialty care as well. Part of us remaining independent has been about how we think about partnerships and affiliations. As a 2.5 hospital system, we are not at the same scale as some of the large, multi-state, multi-facility systems. And so part of that for us is figuring out where does it make sense to partner so we can continue to keep higher levels of care closer to home for the patients that we serve. So we've done this now in a variety of ways through surgery centers. For those of you who've heard about our partnership with Stanford Children's, that's for pediatric subspecialty care. We own 49% of San Ramon Regional through our relationship with Tenet. And then we have a variety of other partnerships, including a couple in the innovation space with Optum Ventures and Concord Health Partners. It's just an example of where think of it as kind of an outsourced innovation model. They do a lot of the horizon scanning and scrubbing of companies, and then we talk with them about the problems we're trying to solve and see if there's a good fit. Most recently, you can see on the far right here, we spun out our home health division in a joint venture because as John Muir, we were not able to operate home health profitably and at scale. It's a really important service for our patients. And so we wanted to make sure we could still secure that service for the community in a way that was financially sustainable. So we partnered with a company called Cornerstone, it's a national home health operator, and they are now the day-to-day operator of home health, but we're still a joint venture holder as well. So we think about these partnerships in lots of different ways, but a lot of it is about how do we be smart about scale and about what's happening with the population in general is aging. That is particularly true for us in our core market. I know around Livermore and Dublin, in that area, it's very fast growing, a significantly younger demographic than say in Walnut Creek, where we have a much higher level of aging population, but also of Medicare and Medi-Cal. About 53% of the patients we serve are Medicare, and about 20% are Medi-Cal. So that creates some really important ways that we think about caring for the community, how we work with community partners, as well as what we're doing in the four walls of our sites. And as such, we have, this is, everybody loves the awards, a lot of very high quality programs in orthopedics, in cardiac care. This one on the lower right is America's Physicians Groups. That's now a national organization around value-based care within physician organizations. And our physician network continues to get what they call elite status every year. We're a magnet program for nursing. It's really important because the Bay Area is a really competitive place to work. And we want to make sure that we get the best nurses we can because hospitals run on nurses. And so it's really important to us as we think about how do we maintain nursing excellence, not just so that we can deliver high quality care, but so we can continue to attract and retain the best talent. As I mentioned earlier, a lot of the work that we're doing is trying to figure out how do we bring higher levels of care closer to home. The Bay Area, as you know, if you've ever tried to drive from Livermore to Walnut Creek at 3 o'clock on a Thursday, it's not great. So how do we get those levels of care wherever our patients are, closer to them? And for a number of our patients, this is about getting what used to be either tertiary or even quaternary services that patients would have to travel, across the bridge to UCSF or down the 680 and down the peninsula to Stanford. We're able to do certain things now in Walnut Creek and Concord that previously would have to go outside the community. One example there are a number of things up here, but we recently recruited a neuroendovascular surgeon, Dr. Ben Yim. I didn't know what neuroendovascular surgery was. Apparently, if you are a neurosurgeon who wants more school, you go and continue your training to do very high level interventions for particularly stroke patients. And these are sometimes called large vessel occlusions in the brain. Dr. Yim is able to do these procedures. The procedure takes about 8 to 12 minutes, but having the ability to do that here and not have to transfer those patients out of the community is a huge help, both for the stroke patients, but also for their families, because it's really stressful, as many of you who've ever had to do this know, if you have to travel a long distance for care. So there's one example of the kinds of things we're doing. We continue to grow our robotics program at both campuses, and that's helping support our surgeons, both on general and bariatric surgery, but also neurosurgery and thoracic surgery, and doing higher levels of procedures in ways that are more sophisticated, and ultimately they end up being safer the higher the volume gets. Something that some people don't always know is we also own and operate an acute psychiatric hospital in Concord. It's relatively small, it's about 67 beds, but John Muir has 10% of the pediatric acute inpatient psych beds in the state of California. And it is one of the few places in Northern California that has adolescent psych beds. And so other than geriatric psych, which we're working on, we basically have the full spectrum of psychiatric care available, including partial hospitalization, intensive outpatient, and other services. This is a really important aspect of what we do. And Jesse Tamplin, who is our lead over behavioral health, also one of our leads in continuous process improvement, has done a really good job helping us think about how do we continue to expand access and improve the quality of service that we have in behavioral health. It is getting more and more important every day to integrate behavioral health effectively into primary care, but also to have resources available for different emerging therapies, TMS, so magnetic stimulation of the brain, ketamine clinics, things that you can do safely and appropriately to continue to help people who are struggling with mental illness or behavioral health concerns. So really important part of what we do. A lot of people don't know about it, but it's there, and definitely a huge resource and asset. More recently, in February of this year, we opened the Bering Pavilion, which is part of the Gene and Ken Hoffman Cancer Center, the JMH UCSF Gene and Ken Hoffman Cancer Center. It's a huge mouthful, but it was a wildly successful capital campaign. We raised over 140 million to date. The building itself was about 280 million to construct, stayed on time and under budget despite COVID, which is kind of impressive. So thanks to Michael Minaldo and our facilities team for being able to do that. But what it allows us to do, it's 155,000 square feet in Walnut Creek. It has full linear accelerator and infusion capabilities. It's got about 55 infusion bays, 3 linacs with room for a 4th, and integrated multidisciplinary cancer care in one place. So if you're a patient and you show up, you can get everything you need in the 4 walls of this building. The only thing we don't do are transplants because we don't have the volume to support that, although we do pre and post transplant care. But this is a really important part of our work with UCSF, again, to bring that higher level of care close to home and really allow patients to have a fully integrated and comprehensive cancer care experience. We'll say if you haven't had a chance to tour the building, I do recommend. It's a beautiful place to be. Nobody wants to get cancer, but if you have to get cancer, this is a really good place to get care. And we're really proud of it. And it's could not have done it without our partnership with UCSF and with a lot of the amazing physicians who we have working in the building. As I mentioned, there was this capital campaign, very, very successful, unprecedented outpouring really from the community in support of what we're trying to do. You can see some pictures of the inside. It's got kind of a ground and sky theme. It's very nature-based. A lot of public art was one of the requirements from the city of Walnut Creek, and it's just a beautiful space to walk through. The lower right, you can see Dr. Tiffany Savon. She's a medical oncologist who leads our cancer medical group. She is also the medical director for the Cancer Center, and she is the first endowed medical director at John Muir. This is part of the evolution of our philanthropic endeavors. We have a new head of our philanthropic foundation, Nevin Kessler. And he has done a really great job working with our donors to help identify opportunities, not just to fund buildings, but also to fund programs. And we're seeing a lot of positive response from people who say, hey, it's great that you built the box. How do you feel about expanding nurse navigation or expanding other patient supportive services? So really thankful to our foundation and our donor community for helping to continue to expand those services that are not always reimbursed by insurance, but are really important for that comprehensive care experience for patients. Everybody asks about AI. It's one of my least favorite questions because AI is like, there's so much hype around AI. But when people talk about AI, they're usually asking about generative AI. AI as such in healthcare has been around for a long time in lots of different ways. John Muir has continued to incorporate it in smart ways. We have this thing called eCart, which is really this early warning system about cardiac arrest. And it gives a flag out to the care team so they can intervene faster. Viz AI, I'd mentioned Dr. Yim and some of the large vessel occlusion work that he does. Viz is a platform that allows for a rapid detection of stroke and gets mobile alerts out to the relevant clinicians. In the stroke universe, time is brain. And so being able to get that alert out very quickly and faster than might otherwise happen can help really avoid more adverse outcomes. And then on the bottom here, ambience. I've probably heard in the news about generative AI scribes. Kind of AI scribes are a few different companies out there doing this work. Ambience is one that we really like. We had one of the first national integrations with Epic and Ambience. It allows, Ambience does not store PHI, so protected health information. It is listening like a scribe would in the session with the physician, but it doesn't store the information. It just generates the note. And part of what we've seen is significant improvements in after hours documentation and also patient and physician interaction. So instead of staring at a screen half the time trying to type in the way it often happens, it's restoring human interaction in the clinic room. So in that clinic visit, your physician is now able to be much more face-to-face with you and have a more, what we would think of as a more traditional interaction than having to be, typing into a screen. So we have a lot of work happening around AI beyond sort of these more simple applications. I will say AI is not coming for anybody's job. It is there really to support the clinical work that our teams do. The number one problem in healthcare right now is a people problem. We are about 55 to 60% labor expense. And a lot of that is skilled labor that is in increasingly short supply. And our patients are getting sicker and more complex. So one of the areas we spend a lot of time thinking about is how are we bringing technology to bear in new ways to support today's workforce, but also to help prime tomorrow's workforce to work differently and be able to care more effectively for patients. We do have a fair amount of community benefit. As I mentioned earlier, 100% of our economic activity goes back into the communities we serve. Last year, it was about 195 million in community benefit. I can see much of that is tied up in caring for Medi-Cal population. We also do a fair amount of charity care. And then we have a number of health professions, education and research programs. Again, this is sort of how are we building the workforce of tomorrow and working with our local community organizations. And then community health improvement and community building, how are we working with partners? And there's been an increasing convergence of our community benefit work and our philanthropic work. Historically, those have been pretty separate. And now we're trying to think differently about how do we bring together the kinds of community partners that we need, who are doing great work, that we need to help care better for our community. And how do we link that up with some of our philanthropic priorities? Because donors also want to make sure that the impact of their dollars is really felt in the communities we serve. So we're having good conversations there about opportunities to do that. So generally, very strong physician network, and we could not do what we do without the strength of our people, both our physicians and our employees. We have a great level of engagement among our employees. COVID was hard on everybody, and we've done a lot of very intentional work building back from COVID with our staff. Continue to have high quality hospitals. Yes, we have the awards wall, but really what, as both a patient and an employee, part of what I really appreciate about getting care for my family is it combines excellence and warmth in a way that I think is really unique to a local health system. And we are here for the community. And that is what we do. It's why we're here. We're not going anywhere. And all the work that you see us continuing to do, both in our traditional core market, but also farther south now in the Tri-Valley, is really geared toward how do we sustainably serve the community more effectively for years to come. If you are looking for a doctor, you can find us online. There is also, if you don't know who you want to see, but you might want to find somebody, we have a new patient match program. Phone number's here. It's open Monday through Friday. They do a really nice job. If you call them and say, I'm looking for a female who speaks this language or who's in this location, they can help filter through the results and help you find somebody who would be a good fit for you or your family member. So that is the thumbnail. Happy to take any questions, comments. Want to just give the overview of where we are and what we're doing. I will say we just closed a major bond offering in August, which was a great opportunity for us to get some feedback from the capital markets about where we are as a company and where we're going. Had one of our existing bond ratings affirmed, got a new rating from Fitch that was also it was A, stable. So that is a good signal for us as a company of the health of our finances and where we're going. So with that, would welcome any questions or comments.
Thank you. Any questions for Paul?
I have a comment. My name is, excuse me, my name is Sally Mathias with Center for Elders and Dependents. We are a PACE healthcare program and looking forward to having our Tri-Valley Livermore Center fully certified and opening early spring of 2025. And I just wanted to say that we are very proud to partner with John Muir Health for our participants. Our network is a portion of the specialty care that physicians that are with John Muir. And we're very, very excited about San Ramon and the plans for that. Thank you very much, Mr. Derringer, for sharing so much information. Thank you.
I'm happy to do it, and thank you. And thanks for continuing to help us serve our community.
Thank you. And I know Sharon mentioned in the chat that if anyone wanted to tour the Cancer Center, she'd be happy to arrange that. So I'd encourage you to take advantage of that offer. It looks like a beautiful space and much needed for our community. If that's it, does anyone have any other comments or announcements they'd like to share before we close out? If not, I'll share our next meeting is Wednesday, November 6th, and what a fantastic, informative meeting today. You can see this is just one of the many benefits we offer here at the Livermore Valley Chamber of Commerce. So please share with your colleagues and friends and encourage them to attend. And hopefully we'll see you all again soon. Have a wonderful rest of your week and weekend.
Thank you.
Bye.
Good to see you, Sharon.
Good to see all of you.
Okay.